With any flea or wormer, obviously you want to put the right dose on, so the first thing you need to do is know the weight of your animal. And Roger weighs about 900 grams. This is a product called Xeno. It does fleas, lice, but it also does some of the internal worms, so roundworm and tapeworm for these little bunnies. The reason we put it on the back of the neck is so that Roger can't groom it off himself. Because obviously if you put it round his bum, he could get round and lick it off himself, whereas if he can't get round and lick something off the back of his neck. Obviously, although Roger can't get it off himself, his companion could potentially lick it off for him. So if you've got more than one animal and you're doing spot-ons, you want to separate them so that they can't groom it off each other. If you're worried that your animal had been grooming the flea spot-on off themselves, you might see a lot of foaming around the mouth, so a lot of saliva, wetness around their chin. Sometimes cats especially will like flick their heads around and you get sort of long strings of saliva. That's often because the product is a bitter taste, which is partly designed to stop the animal licking too much off themselves. Often with kittens is that they'll scratch the area and then lick it off their foot, so that's something to keep an eye on as well, at least for the first 20 minutes or so while it really soaks in. If you have children in the house, what you don't want is to put the spot on the animal and then the kids touch the area and get it on their hands. It's unlikely to cause any long-lasting issues, but obviously you don't want to cause irritation to the skin or have the kids then put the drug in their mouth. So if they do get it on their hands, just wash with soap and water. You want to wait at least 48 hours after the puppy's had the spot on, because obviously what you don't want to do is put a spot on and then wash it straight back off again when you bath the puppy. So time it so that you're not going to be bathing your puppy for at least 48 hours. So in general you've got two broad groups of spot-ons, prescription and non-prescription. Prescription products are ones that you can only get from your vet, and that's because they're prescription strength. So that often means that they kill a wider variety of parasites, for example, or the drug is fairly new on the market, which means it's much more effective. The benefit of using products specifically from your vet is that you know you're getting the right dose. People can miscalculate the dose of things that they've bought over the counter or accidentally buy a cat product for a dog or vice versa. So from that point of view, it is safer to get products directly from your vet. Prescription strength products cover a wider variety of parasites, so lungworm for example, the parasite you can get from slugs and snails. You can only buy products from your vet for lungworm. There's nothing off the shelf that covers lungworm. The benefit of non-prescription products is often they are more widely available, so places like Pets at Home, supermarkets, online pharmacies, Costco will sell non-prescription products. But the downside is that, like I say, they don't tend to cover as many parasites, so it depends on what your pet is at risk for as to whether or not you can manage with a prescription versus a non-prescription product. Flea and worm treatment can be a treatment or it can be a prevention. For example, there are two prescription strength products that do lungworm. One is the Spot-On Advocate, and that prevents and treats lungworm, and the other is the tablet Milquantal, and that prevents only. Most animals take flea and worm spot-ons and tablets very well, and we very rarely see side effects. With spot-ons, very rarely you can get things like hair loss at the area, or a little bit of scratching possibly, but again it's very, very rare, and again if it does happen we tend to just stop using that drug and use something different in the future. Just contact your vet or nurse and they'll be able to advise you. Because those drugs often are prescription strength and are often very new on the market, it's important that you're seen by a vet first, and the vet can do a thorough health check of your animal to make sure that they're healthy enough for those products, and then discuss with you your specific animal's issues in terms of parasite control. Roger might be an outdoor bunny and exposed to fleas and lice because there are hedgehogs in his garden, or he might be an indoor bunny, but there might be a cat in the house, so we might be more worried about parasites that the cat might be bringing in. Obviously, if there are kids in the house, we're going to be worried about things like roundworm, which can be spread to children. And again, that's why we would tend to recommend getting these products directly from your vet to make sure that you've got the right thing for you. The fleas that are living on your animal are what we call the tip of the iceberg. So about 90% of the adult fleas, eggs and larvae will be in the environment, which unfortunately is your house. So that means your carpets, your sofas, your bedding, the animal's bedding, anywhere where the animal goes in your house, there's going to be fleas, adults, eggs and larvae that you need to deal with. So often if you've gone to the vet and you've been prescribed a flea spot on, in this scenario you would also be prescribed a flea spray, and that's for the house, so not to use on the animal, that's to use in the environment, to kill the eggs and larvae, and to stop them then hatching and reinfesting the animal afterwards. The other thing you might weirdly be prescribed is a wormer, and that's because fleas can carry the intermediate stage of tapeworm. So when an animal grooms themselves because they're itchy from the fleas, they swallow the flea, the tapeworm egg hatches inside the animal, and then the animal is infected with tapeworm on the inside as well as fleas on the outside. So that's why your vet might prescribe you a tapeworm tablet as well as your flea spot-ons. Thanks very much for watching. I hope this was helpful. If you've got any questions or concerns, feel free to write them in the comments. I'm Dr. Amy Dyce, this is Dr. Roger Rabbit, and we're from Vets on Pet Street.